This is Emily Baker. It is January 23rd at 11:43 a.m. Eastern Time. From my head to toe, scan the room. There's a 10-foot Snellen chart on the wall. And my patient Mark. We'll begin. Throughout the exam, I'm going to be inspecting Mark's skin for color, temperature, moisture, texture, edema, turgor, bruises, scars, lesions, and nevi. I'm going to begin with his head and assess for shape and midline, symmetry, assess color, hair color and distribution. I'm going to palpate for hair texture, any depressions, masses, tenderness. Palpate lymph nodes, occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, posterior cervical, anterior cervical, and supraclavicular. Palpate frontal and maxillary sinuses for tenderness. Palpate temporal arteries for tenderness. Assess cranial nerve 5 by palpating masseter muscle as Mark clenches his jaw. And assess TMJ for subluxation crepitus. Open your mouth, please. And close. Excellent. I'm going to inspect his ears for placement and symmetry. Palpate the pinna and tragus for any masses or tenderness. I'm going to inspect his auditory canal and tympanic membrane. I will assess cranial nerve 7 by asking Mark to raise his eyebrows, smile, frown, puff out your cheeks, and puff your lips. Excellent. Continue to assess cranial nerve 5 with light touch. Please close your eyes and tell me when and where you feel this.
Forehead, left cheek, nose, right cheek, chin, left arm, right hand, left leg, right leg, left foot, right foot.
Okay. I will assess cranial nerve 8 with the whisper, vapor, and Rin hearing test. Tell me what you hear.
99. 99.
Do you hear this louder in one ear or equally?
Equal.
All right. And please tell me each time you stop hearing this.
Okay.
Air conduction is greater than bone conduction. Moving to Mark's eyes. If you'll stand behind the blue line, I'm going to assess cranial nerve 2 by asking Mark to cover the right eye. Read the bottom line.
LEF-OD-PCT.
And cover your left eye. Same.
LEF-OD-PCT.
Excellent. You may sit. And 20/20 vision. I'm going to inspect Mark's eyebrows, lashes, palpebral fissures, conjunctiva and sclera for color lesions discharge. Assess cranial nerve 3 with pupillary response to light. Please look right up there. Now look at my pen. And assess cranial nerves 3, 4, and 6. Please follow my pen. Excellent. Now we'll inspect Mark's red reflex and internal eye structures with the ophthalmoscope. Moving to Mark's mouth, I'm going to inspect his lips, he's open, teeth and gums, his buccal mucosa, salivary ducts, floor of his mouth under his tongue. Please stick your tongue out. Cranial nerve 12 intact, midline no fasciculations. Say ah.
Ah.
Cranial nerve 9 and 10 intact as the uvula and palate rise equally with phonation, and tonsils present grade 2. I'm going to assess cranial nerve 1, asking Mark, close your eyes and tell me what you smell.
Coffee.
Excellent. Alright. Moving to Mark's back, if you will turn to the side, please. I'm going to begin by assessing for any signs of respiratory distress, a sign for any deformities and symmetry, and equal chest expansion. Take a deep breath. Excellent. And percuss over the lung fields. Now we'll auscultate over the lung fields. Deep breath. Assess for egophony, bronchophony, and whisper pectoriliquy. Say E.
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 And Mickey Mouse.
Mickey Mouse. Mickey Mouse.
And whisper Mickey Mouse. Excellent. Each time you feel my hand, please say 99.
99. 99. 99. 99. 99. 99.
Symmetrical tactile fremitus. And assess for CVA tenderness. Alright, you may turn forward. Anteriorly, I'm gonna assess for any signs of respiratory distress, any deformities, equal chest expansion. Thank you. And I will auscultate lung sounds. Deep breath. I'm going to auscultate over his carotid arteries for bruits. None present. Assess trachea midline. Palpate his thyroid, please look to the left. Swallow. Swallow. Palpate his carotids. Excellent. Assess range of motion for his neck. Please bend your hip forward, flex, and back to normal extension, ear to shoulder, and circle. Excellent. I will now listen to Mark's heart sounds. The aortic, which is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, which is also PMI, the fifth intercostal space, left sternal border. Gonna repeat the auscultation with the bell. Now we'll auscultate his heart rate for a minute. Rate of 82, regular rate and rhythm. And next I'll ask Mark to lie down, please. I'm gonna observe for any heaves and lifts and palpate for any thrills over his cardiac points. I'm going to observe for any jugular venous distension and measure for JVP with this mid-axillary. 9 centimeters on the other side. 9 centimeters. And I'm going to repeat the auscultation of the cardiac points. And with the bell. Listen, the aorta, bilateral renal arteries, bilateral iliac arteries, bilateral femoral arteries, for any bruits. Listen for bowel sounds, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I'm gonna observe his abdomen for contours and symmetry. I'm gonna percuss. Palpate for any masses or tenderness. be palpation liver. Just relax. And spleen. And while he's here, we're gonna check internal and external rotation of his hips. And in. Excellent. This one. And in. Excellent. All right, you may return to the chair. As I assess Mark's joints, I'm gonna be inspecting and palpating for any redness, edema, deformities, nodules, warmth, crepitus throughout all of his joints. Begin with his hands and wrists. It says capillary refill. Feel for radial pulses. And grip strength. Thank you. It says range of motion for his fingers. Hold your hands out, please. And flex your fingers down, up, and abduct. And for wrist, flex, extend, abduct, adduct, circumduct. Excellent. I'm going to feel his elbows and shoulders. Range of motion for his elbows. Arms down at your sides. And bend your arms up and down. Excellent. Of shoulders. Arms out to your sides, please. And all the way up over your head. Take your arm between your shoulder blades and the other arm. Then take your arm to your lower back. The other arm to your lower back. Internal, external rotation. If you will, testing biceps and triceps strength, pull against my hand and push. And this side, and push. And shoulder strength, push against my hand and pull. Push against my hand and pull. Assessing Mark's reflexes, the brachioradialis, biceps, triceps, just relax. And on this side. Just relax. Assessing stereognosis and graphesthesia, please close your eyes. What if I put in your right hand?
Key.
What if I put in your left hand?
One.
Keep your eyes closed. I'll draw on your hand. Tell me what I draw.
8. A.
Excellent. All right, moving to Mark's lower extremities. Again, I'm going to begin by inspecting and palpating. Feet, toes, ankles. Capillary refill. Dorsalis pedis pulses. Posterior tibial pulses. Range of motion for his toes. Please curl your toes and raise them. Abduct. Spread them apart. Adduct. Excellent. If you will plantar flex your feet. Range of motion for his ankles and dorsiflex. And inversion, eversion, and circumduction. All right. Pull your feet up against my hands. Excellent. And push. Great. Kick your legs out against me. Other leg too. All right, now pull back against me. Testing strength at his knees. Gonna test the Babinski reflex. And the Achilles. And the patellar. Just relax. Okay. And Mark, if you will stand, please. We're going to assess range of motion for his knees. If you will bend each leg, please. Thank you. Continue range of motion for his hips. If you will straight pull your whole leg out forward and back. And then backward. Excellent. And the other one backward. Great. You will push your leg out against my hand. Excellent. And this side. And pull. Great. And pull. Excellent. Range of motion and strength of hips. If you will turn to the side, please. I'm going to be inspecting Mark's spine for expected curvature and symmetry. If you'll bend forward, assessing for scoliosis and also range of motion for his back. If you will stand back up and bend back at the waist. Back up to the right, to the left, and twist. Excellent. If you will start over here and walk to the couch and stop. And if you'll walk back, heel to toe. All right. You'll stand in the middle again. Your feet together, arms at your sides. Close your eyes. Romberg sign. All right, you may open. If you will hop on each foot. All right. Excellent. And this concludes the examination for Mark.